ఈ పేపర్ డిస్కషన్ లో ఈచ్ అండ్ ఎవ్రీ టాపిక్ కవర్ చేస్తున్నాము. అండ్ నేను పేపర్ డిస్కషన్ ఎట్లా చేస్తాను అంటే, ఇప్పుడు ఒక క్వశ్చన్ ఇచ్చారు, దాని రైట్ ఆప్షన్ ఏంటి, ఎందుకు మిగతా 3 రాంగ్ ఆప్షన్స్, అండ్ యాజ్ వెల్ యాజ్ ఆ 3 ఆప్షన్స్ కి ఎక్స్ప్లెనేషన్. సో కొన్ని క్వశ్చన్స్ సూటిక్స్ పార్ట్, మైక్రోబయాలజీ, కాగ్నసీలో మాక్సిమం ఎక్స్ప్లెనేషన్ అనేది ఉండదు. మాక్సిమం డైరెక్ట్ క్వశ్చన్సే ఉంటాయి. బట్ కమింగ్ ఆన్ టు ఫార్మకాలజీలో మాత్రం ఎక్స్ప్లెనేషన్ కంపల్సరీ ఉంటుంది. అండ్ కమింగ్ ఆన్ టు ఫార్మకాలజీ పార్ట్, మనకి డ్రగ్ ఇన్స్పెక్టర్ ఎగ్జామ్ లో ఎలా ఇస్తారంటే, మరీ మనం అనుకున్నంత లెవెల్లో టఫ్ గా ఏమి ఇవ్వరు. ఇఫ్ యూఆర్ హ్యావింగ్ లిటిల్ బిట్ ఐడియా అబౌట్ ఫార్మకాలజీ, యూ కెన్ అటెంప్ట్. అంటే ఫార్మకాలజీలో మాక్సిమమ్ డ్రగ్ క్లాసిఫికేషన్స్, మెకానిజం ఆఫ్ యాక్షన్, సైడ్ ఎఫెక్ట్స్ అట్లా ఈజీగానే అడుగుతారు. సో కమింగ్ ఆన్ టు ఎక్స్ప్లెనేషన్ పార్ట్ కి వచ్చేసరికి నేను మాక్సిమం ఫార్మకాలజీ పార్ట్ లో ఎక్కువ టైం తీసుకొని ఎక్స్ప్లెయిన్ చేస్తాను. వై? బికాస్ మోస్ట్లీ ఫార్మకాలజీ క్వశ్చన్స్ వస్తాయి, మనకి 60 క్వశ్చన్స్ వస్తాయి. సో ఇప్పుడు మీరు అటెంప్ట్ చేసేటప్పుడు ఏవైనా కీ మిస్టేక్స్ ఉంటే ఐ రెక్టిఫై వైల్ ఐఎమ్ ఎక్స్ప్లెయినింగ్ యూ. మీరు క్వశ్చన్ అంటే పేపర్ అయితే అటెంప్ట్ చేయండి. విల్ ట్రై అవర్ లెవెల్ బెస్ట్ టు గివ్ ఫ్రమ్ ద సిలబస్ ఓన్లీ అండ్ విల్ గివ్ యూ ద కరెక్ట్ కీ. ఒకవేళ బై మిస్టేక్ 1-2 కీ మిస్టేక్స్ ఉంటే యూ హ్యావ్ టు అడ్జస్ట్. వైల్ ఐఎమ్ ఎక్స్ప్లెయినింగ్ ఐ ఎక్స్ప్లెయిన్ యూ. ఎందుకు అది రాంగ్ ఆన్సర్, ఎందుకు అది కరెక్ట్ ఆన్సర్ అనేది నేను ఎక్స్ప్లెయిన్ చేస్తాను. ఇఫ్ దిస్ ఈ టైప్ ఆఫ్ ఎక్స్ప్లెనేషన్ ఓకే అంటే ఐ కంటిన్యూ. ఐ డోంట్ నో, నేను ఫస్ట్ క్లాస్ చెప్పాను ఆ టైప్ ఆఫ్ ఐ డోంట్ నో వాట్ ఈస్ యువర్ ఫీడ్బ్యాక్. ఏవైనా నెగటివ్స్ ఉంటే మాత్రం నాకు చెప్పండి, ఇమీడియట్ గా చెప్పేసేయండి, నేను రెక్టిఫై చేసుకుంటాను. అండ్ థర్డ్ పేపర్ నుండి మాత్రం నా రిటర్న్ పార్ట్ ఆఫ్ నోట్స్ నేను మీకు ఇచ్చేస్తాను. ఈవెన్ మీరు పేపర్ 2 ప్రిపరేషన్ స్టార్ట్ చెయ్యకపోయినా ఈ క్లాసెస్ విని నా నోట్స్ చదివితే ఇట్ ఈస్ మోర్ దాన్ ఎనఫ్. మాక్సిమం ఇలానే అడుగుతారు క్వశ్చన్స్. ఓకే, నేను స్లోగానే వెళ్తాను, మాక్సిమం స్లోగానే వెళ్తాను. అంటే ఫస్ట్ డే కదా, 1 అవర్ లో కంప్లీట్ చేయాలి అన్నట్టు అలా అయిపోయింది. బట్ మాక్సిమం నేను స్లోగానే వెళ్తాను. సో కమింగ్ ఆన్ టు ద ఎక్స్ప్లెనేషన్ పార్ట్ ఆఫ్ టుడేస్ క్వశ్చన్ పేపర్. అండ్ ఇంకొకటి ఏంటి అంటే, మీకు అడ్మింగిల్లో క్వశ్చన్ నెంబర్స్ చేంజ్ ఉంటాయి. కమింగ్ ఆన్ టు మీ ఆ క్వశ్చన్ నెంబర్స్ చేంజ్ ఉంటాయి. సో నేను క్వశ్చన్ చదువుతాను, ఆన్సర్ చెప్తాను. ఓకే, I'm going to start the class. If you are okay, I'll start the class. Okay. Coming on to first question. ఫస్ట్ క్వశ్చన్ ఏంటి మనకి, వాట్ కాజెస్ జాండిస్ అంటే మనకి జాండిస్ ఎలా వస్తుంది. కమింగ్ ఆన్ టు ఆప్షన్స్. ఆప్షన్ ఏ ఏంటి, ఎక్సెసివ్ ఆల్కహాల్ కన్సెప్షన్. మనం ఆల్కహాల్ అంటే ఎక్కువ అమౌంట్ లో తీసుకున్నా గానీ మనకి జాండిస్ అనేది కాజ్ అవుతుంది. నెక్స్ట్ సెకండ్ ఆప్షన్ ఏంటి, హెపటైటిస్ ఏ ఇన్ఫెక్షన్. ఇది కూడా మనకి ఒక ప్రీ రిక్విజిట్ జాండిస్ కాజ్ అవ్వడానికి. నెక్స్ట్ థర్డ్ ఇది ఇంజెక్షన్ ఆఫ్ కంటామినేటెడ్ ఫుడ్. కంటామినేటెడ్ ఫుడ్ అంటే ఇక్కడ కంటామినేటెడ్ ఫుడ్ అంటే ఏంటి అంటే, ఆయిలీ ఫుడ్స్, మనం ఎక్కువ టర్మరిక్ యూజ్ చేసిన ఐటమ్స్ తీసుకోవడము, లేదంటే ఆయిల్ ఫుడ్ ఐటమ్స్ తీసుకోవడం వల్ల కూడా మనకి జాండీస్ అనేది కాజ్ అవుతుంది. సో యువర్ కరెక్ట్ ఆప్షన్ ఇస్ ఆల్ ద ఎబో. మీ కరెక్ట్ ఆప్షన్ ఆల్ ద ఎబో. నెక్స్ట్ సెకండ్ క్వశ్చన్ ఏంటి అంటే, యాంటీ యాంగ్జైటీ ఏజెంట్స్ హ్యావ్ అంటే యాంటీ యాంగ్జైటీ ఏజెంట్స్ ప్రాపర్టీస్ ఏంటి. ద ప్రాపర్టీస్ ఇట్ హ్యావ్ సెడేటివ్ యాజ్ వెల్ యాజ్ హిప్నోటోనిక్ యాక్టివిటీ. ఈ ఆప్షన్ కరెక్ట్. దెన్ కమింగ్ ఆన్ టు సెకండ్ ఆప్షన్, మజిల్ రిలాక్సింగ్ అండ్ యాంటీ కన్వల్సెంట్ ఎఫెక్ట్. ఈ ఆప్షన్ కూడా కరెక్టే. థర్డ్ది అమినేషియా ప్రాపర్టీ, అమినేసిక్ ప్రాపర్టీ. ఫస్ట్ అమినేసిక్ ప్రాపర్టీ, ఈ అమినేసిక్ మీనింగ్ తెలవాలి మీకు. అమినేసిక్ మీన్స్ లాస్ ఆఫ్ మెమరీ, అంటే మొత్తం లాస్ అవ్వరు, పార్షియల్ లాస్ ఆఫ్ మెమరీ. సో మన క్వశ్చన్ ఏంది, యాంటీ యాంగ్జైటీ ఏజెంట్స్ హ్యావ్. these anti-anxiety agents have all these three properties. So your answer is B. Your answer is D. So coming on to, okay, E question clear చేశారు. But sometimes they'll ask you what is the mechanism of action of anti-anxiety agents. The mechanism of action is these anti-anxiety agents mainly acts on GABA receptors. GABA receptors పైన యాక్ట్ చేస్తుంది. And what is the function? Okay, they'll act on GABA receptors. What is its function means? It mainly opens the chloride channels. It mainly opens the chloride channels and extends the penetration of fluoride ions into it. Chloride channels open చేసి ఆ chloride ions ని GABA receptor లోపలికి ఎంటర్ చేయడం. This is the function of anti-anxiety agents. Next, coming on to third question. Which of the following should not be mixed with other wastes to avoid contamination? It is a direct question. దీనికి explanation ఏమీ అవసరం లేదని నేను అనుకుంటున్నాను. The option is animal waste. The option is animal waste. Next, fourth question. Which of the following fermentation processes is used in the production of penicillin? అంటే penicillin production కి మనం ఎలాంటి fermentation process యూజ్ చేస్తాం? Mainly will be using the aerobic fermentation. Okay, aerobic fermentation తోని మనము penicillin ని will produce. But what are the conditions? Penicillin produce చేయడానికి we need certain temperature, we need certain pH. You know this temperature and pH. The pH required for the production of penicillin is 6.4 to 6.8. Kindly note the temperatures. Okay, the temperature required is 25 to 27 degrees Celsius. 25 to 27 degrees Celsius. And coming on to pH, pH required is 6.4 to 6.8. And to ferment, to produce this penicillins, we mostly requires 4 or 5 days. 4 or 5 days. Make ichna option, okay, it is aerobic fermentation, it is correct. But you need to memorize the temperature, pH, and how many days it is required. You need to memorize these also. Next question is, which among the following statement is true? ikkada meer confuse avutunnaru. You read the question properly. True, ikkada true enti anesi adutunnaru. So first option enti, glycolysis occurs in only mammalian cells. It is a wrong option. Glycolysis takes place in plants and animals also. And manaki second option em icharu, glycolysis occurs in mitochondria. Mitochondria lo kaadu, it takes place in cytosol. Mitochondria lo Krebs cycle. Krebs cycle takes place in mitochondria. Then third option, glycolysis occurs in presence and absence of oxygen. It is correct. It is correct. It takes place in both presence and absence of oxygen. But option D kochesariki, option D is wrong. Glycolysis occurs when ATP concentration is high. ATP concentration, if you are having low or less, glycolysis takes place. If final product in aerobic condition, we require 8 ATP, and in anaerobic condition 2 ATP unna gani glycolysis takes place. So your option D is wrong. So rest all are correct. Sorry. C is correct. C is correct. A, B, D are wrong. A, B, D are wrong. Then next, correct statements listening characteristics of a particular route of drug administration. Particular route of drug administration. And మీరు నా క్వశ్చన్ చేస్తారు, మేడం జనరల్ ఫార్మకాలజీ లేదు కదా. బట్ జనరల్ ఫార్మకాలజీ లేకపోయినా when we are learning about other classes of drugs, కొన్ని డ్రగ్స్ మనకు ఉంటాయి. విల్ బి టేకింగ్ బై ఓరల్ రూట్, విల్ బి టేకింగ్ బై ఐఎం రూట్, అలా ఉంటది కాబట్టి ఐ హ్యాడ్ ఫ్రేమ్ ద క్వశ్చన్ ఇన్ దిస్. ఓకే, కమింగ్ ఆన్ టు ఫస్ట్ ఆప్షన్, ఇంట్రావీనస్ అడ్మినిస్ట్రేషన్ ప్రొవైడ్స్ ఎ ర్యాపిడ్ రెస్పాన్స్. ఎస్, ఇది కరెక్ట్. ఈ ఐవి అడ్మినిస్ట్రేషన్ ప్రొడ్యూసెస్ ద ర్యాపిడ్ రెస్పాన్స్. కమింగ్ ఆన్ టు సెకండ్ ఆప్షన్, ఇంట్రామస్క్యులర్ అడ్మినిస్ట్రేషన్ requires sterile technique. These option is also correct. But our question is anni correct. Which of the following option is wrong? Except anichar. Except. Coming on to C, inhalation provides slow access. It is wrong. Wrong. Inhalation doesn't provide slow axis. It provides rapid axis. Ela rapid ante common example. I'll give you the common example. If you are suffering from cough, so you'll be having the breathing problem. If you'll inhale the Vicks, within few seconds, you'll get the rapid action. So slow anedi wrong. Inhalation provides rapid access. Then coming on to D, subcutaneous administration may cause local irritation. It is correct. It is correct. So sixth question answer is C. Sixth question answer is C. Then next, seventh question, which of the following is not a function of small intestine? Not, ikkada not anundi. Not a function of small intestine. So your answer is C. Your answer is C. Enduku C అని కూడా నేను explanation ఇస్తాను. So small intestine, it absorbs the nutrients and it also secretes the digestive enzymes. It is also correct. And it also absorbs the water. But coming on to C option, mechanical digestion, and both mechanical as well as chemical digestion takes place in mouth and stomach. Mechanical digestion inka chemical digestion takes place in mouth and stomach. Mouth lo teeth. Mechanical digestion by chewing only the bigger particles are broken down into smaller particles. So mechanical digestion takes place in stomach and mouth, teeth. Then eighth question, it is a direct question. Aspartame is used as, it is mainly used as a sweetening agent. Then next, coming on to ninth question, dash is the example of gelling agent. Gelling agent ke example enti? The answer is pectin. Idi kuda direct question. Almost direct questions ki nenu explanation ivvanu. I don't want to waste your time also. Then next question is, identify a super disintegrating agent. Super disintegrating agent ante enti? Lactose kaadu, starch kaadu, stearic acid kaadu. So D. First manaki SSG ante full form telvali. SSG full form is sodium starch glycolate. Sodium starch glycolate. So apart from this sodium starch glycolate, some other examples are also there for super disintegrating agent. You note that examples. I'll dictate you. Cross caramelase, and second example is cross povidin. And third example is magnesium aluminium silicate. Magnesium aluminium silicate is also called as VGUP. So these are the other examples of disintegrant. Then 11th question, the example of capsule fruit. Asal manaki ee question solve cheyali ante you need to know the meaning of capsule fruit. If you know the meaning of capsule fruit, you can answer this question. I guess most of you blindly put the option all the above. 90% students had put the option all the above. Okay, it is correct answer. But the meaning of capsule fruit is it is a dried form of fruit. When it ripens, it gets open. It is a dried form of fruit. When it gets open, it will ripen. So అది ఓపెన్ అయినప్పుడు మాత్రమే it will get ripen. And cotton ఉంది. Cotton it in the initial stage it will be in the closed form. But when the growth stage increases or when it comes onto the growth stage, slowly it will get open. Okay. So this is the meaning of capsule fruit. Then 12th question, what is the primary stain used in acid fast staining technique? Acid fast staining technique lo manam use chese primary stain is carbofuscin. But coming on to explanation part, carbofuscin, okay, acid fast staining lo will be using the carbofuscin. But meaning carbofuscin, okay, manam ఒక యాసిడ్ ఫాస్ట్ బ్యాక్టీరియాకి కార్బోఫస్టిన్ మనం ఇచ్చాము. ఇస్తే what color it produces you need to know. So if the bacteria is a acid fast, it produces red color. It produces red color. ఒకవేళ బ్యాక్టీరియా అనే యాసిడ్ ఫాస్ట్ అయితే it will produce red color. But if it is non-acid fast bacteria, it produces blue or green stain. It produces blue or green stain. Then next question is, one of the following is an example of chemical method of evaluation. Chemical method of evaluation ante your answer is detection of alkaloids. Detection of alkaloids. It is a chemical method of evaluation. But coming on to explanation of other three options. First option in determination of volatile oil content. It is a chromatographic technique. It is a chromatographic technique. Coming on to next, second option in determination of refractive index. Refractive index can be determined with the help of refractometer. So it is not a chemical method of evaluation. Next, fourth option is observation of type of vascular bundles. Vascular bundles means microscopic examination. So this is also not your correct answer. Your correct answer is detection of alkaloids. Then 14th question, which of the following enzyme deficiency leads to hemolytic anemia? I don't want to waste much time in this question. Why? Because you can refer my biochemistry notes. Disorders of carbohydrate, I had already told you. You refer that. Okay. So the option is A, pyruvate kinase. Next, 15th question, which of the following treatment is most effective for Helicobacter induced peptic ulcers? Helicobacter induced peptic ulcer. So I'll give you the explanation for each and every option. So even we can use proton pump inhibitors for Helicobacter peptic ulcer treat cheyadaniki we can use proton pump inhibitors. Even we can use antacids, but antacids does not induce a peptic ulcer. Peptic ulcer ni treat cheyadu. Antibiotics, we can use antibiotics also for the treatment of peptic ulcers. Even we can use H2 blockers also for the treatment of peptic ulcer. These four options, these four substances we can use for the treatment of peptic ulcer. But our question is most effective ante, if your peptic ulcer stage is, if it is in the final stage, at that time along with the peptic ulcer drugs we'll be using antibiotics kuda manaku istaru. So coming on to proton pump inhibitors. First option ఏంటి proton pump inhibitors. If you are suffering from Helicobacter pylori, first treatment మనకి ఏమి ఇస్తారు అంటే, first they'll refer you, the doctors will refer you proton pump inhibitors only. If you are in the initial stage of peptic ulcers, they'll give you proton pump inhibitors. So the mechanism of action of this proton pump inhibitors is they'll reduce the gastric acid secretion. Coming on to antacids, they will not cure, listen carefully, they'll not cure you the peptic ulcer treatment. Peptic ulcers cure cheyalevu ee antacids, but they'll give relief from this peptic ulcer treatment. Few 1 week oka 10-15 minutes lo naku relief kavali annappudu antacids istaru. These antacids doesn't cure peptic ulcers, they'll give relief from your peptic ulcer. Coming on to antibiotics, when the peptic ulcers are in final stage, at that time we'll refer you the antibiotics. Coming on to H2 blockers also reduces the gastric acid secretion. So how it reduces? It reduces the gastric acid secretion by blocking the H2 receptors. H2 blockers ikkada option lone undi, blockers ante it will block the H2 receptors. So no, everyone note what I'm dictating now. Why? Because some of the in one of the paper I had found this question. So famotidine is most potent H2 receptor. You write this. Famotidine is a most potent H2 receptor that is most commonly used to treat ulcer. They'll frame you the question, what is the common H2 blocker which treats the peptic ulcer. Ante you have to answer famotidine. Famotidine. Is this 15th question clear for you all? Why? Because it is a pharmacology part. I know most of us, even I am also poor in pharmacology. So next, coming on to 16th question. 16th question is 16th question is urethral suppositories are also called as urethral. Ikkada meeru what 15th yes 15th question answer is answer ante almost all but effective అని ఇచ్చారు కాబట్టి answer is C. Effective ante answer is C. So coming on to 16th, urethral suppositories are also called as Bougis. Bougis means these Bougis are used in both males and females. So it mainly used for the infections which are caused in urethra, prostate glands. Okavela urethra, prostate glands infections unte, we'll be using the Bougis. Coming on to pessaries. Why we'll be using? When you will be using pessaries means if you're having the vaginal infections. If you're having the vaginal infections, at that time we'll be using the pessaries. Coming on to enema. Enema is also a suppository. But enema means it is a liquid form of injection. It is a liquid form of solution that is injected into our rectum. Why it is injected into our rectum means in order to empty our bowels. So you note this point. Enemas are used to treat constipation. Enemas are also used to treat constipation. Coming on to douches. Douches are also used to clean the vagina. To clean the vagina. Is 16th question clear for you all? It is very easy. But I had cleared the confusion about what is urethral suppository, why pessaries are used, where, in which condition enemas are used. In this way, I had cleared you. Next, 17th question. Which of the following is a common cause of urinary tract infection? Common cause of urinary tract infection ante bacteria. So your 17th question answer is both bacteria and fungi. Your answer is D. Both urinary tract infection ante bacteria and fungi both comes under urinary tract infections. Coming on to liquefaction is an example of, it is a direct question. I don't want to waste time in the explanation. Your answer is both A and B. Next, coming on to 19th question. Which of the following liquid dosage form is required for sterile formulation? Sterile. Ekkada sterile అని వచ్చినా you keep in mind sterile means eye drops. Sterile అనగానే eye. Then which of the following is the most accurate method for microbial assay of antibiotic? It is direct question. The answer is chemical assay. The answer is chemical assay. Next, coming on to 21st question. Coming on to 21st question. Mecamylamine is a dash. Mecamylamine is a secondary amine. But what I'm going to explain what is the mechanism of action of this mecamylamine. It is a ganglionic blocker. Mecamylamine is a ganglionic blocker. So it's ganglionic blocker ante it mainly prevents the stimulation of postsynaptic receptor by acetylcholine. It prevents the stimulation of postsynaptic receptor by the help of acetylcholine neurotransmitter, which is released from the synaptic nerve endings. I don't want to explain why, because most of you know what is presynaptic and what is postsynaptic. I had just explained what is the mechanism of action and at which category this mecamylamine comes. Mecamylamine is a ganglionic blocker. Then 22nd question. In the McConkey agar test, the response showing pink color around the colony indicates the presence of. It is also a direct question. It is gram-negative bacteria. Gram-negative bacteria. So coming on to explanation part. Okay, ఈ MAC Conke agar test, it is used to detect the presence of pink color in gram negative bacteria. Apart from this, why we are performing this MAC Conke agar test is to differentiate our bacteria, whether they are able to differentiate the bacteria on the ability to ferment the lactose. Ante ఏ కైండ్ ఆఫ్ గ్రామ్ నెగటివ్ బ్యాక్టీరియా లాక్టోస్ ని ఫర్మెంట్ చేస్తుంది, ఏ కైండ్ ఆఫ్ బ్యాక్టీరియా is not fermenting the lactose. In this way you can differentiate by this MAC Conke agar test. Then 23rd question, which of the following statement is known as rate limiting step? I don't want to waste much time. It is a direct question. It is phosphofructokinase. It is used to convert fructose 6-phosphate to fructose 1,6-bisphosphate. Then next 24th question, thorn apple is a synonym of Stromonium and Datura. So your option is both A and B. For pharmacognosy, you refer my written notes. Then coming on to gram staining was developed by Danish bacteriologist. Then 26th question, chromatography is used for separating the mixtures. Venom of cobra is dash in nature. It is a neurotoxic in nature. 27th, it is a neurotoxic in nature. Coming on to 28th question, which of the following is a common method for preventing the Clostridium difficile infections? Clostridium difficile infections ante you need to know the meaning of what is Clostridium difficile infection. Meeku ee Clostridium difficile infections ante meaning teliste you can easily answer. The answer is use of contact precautions. Clostridium difficile infections means it is a kind of germ. This Clostridium difficile is a kind of germ which mainly causes you diarrhea and colitis. Colitis means inflammation in colon. Is 28th question clear for you? Explanation of 28th question is clear for you all. The next 29th question. Which of the following is not a type of health associated infection? If you know the meaning of health associated infection, then you can easily answer the question. The answer is malaria. So health associated infection means it is a kind one of the person will get infected while he is receiving any of the health care for other conditions. For example, one of the person is suffering from cancer, so he will be taking the chemotherapy. Along with chemotherapy, you will be having some other side effects also. So that are known as health care associated infections. Then next 30, question number 30. As per Drug and Cosmetic Act, Schedule FF is related to. It is a direct question. It is ophthalmic preparations. Next 31st question. Turpentine element is used on skin as a. It is mainly used as a counter irritant. And next 32 question. Lignified trichomes are present in. Mostly lignified trichomes are present in Naxomica. So in your syllabus, they had mainly focused on biological source and chemical constituents and uses and. So I did not mention about microscopy. So when the question comes about microscopy, at that time I'll explain you about the microscopy of any of the particular important drug. Mostly they won't touch you. They won't ask you about microscopy in pharmacognosy. The next 33rd question. What is the cause of AIDS? All. I don't want to explain why, because it will be childish if I'll explain this also. Then what is the penalty for the manufacturing or selling a medical device without valid license? Your answer is imprisonment for 3 years or fine. I have a tabular column for the penalties. Someone remind me. I'll share you the written notes after the completion of class. You can refer that. That is enough. Then 35th question. Dash are dilute solutions containing readily soluble constituents of the crude drug. Even idi kuda direct question. It is a definition. Infusion. So coming on to percolation. First option is percolation. The meaning of percolation is filtering the fluids by the porous membrane. Decoction ante boiling or heating any of the substance. Next, coming on to 36th question. What are the signs and symptoms of GERD? Blind ga andaru all the above pettesi untaru. So answer is correct. Coming on to explanatory part, GERD ante it is a gastroesophageal reflux disease. So in this kind of disease, what it takes place means gastric acid from the stomach, whatever the gastric acid that is present in stomach, it will come back into esophagus. It will come back into esophagus. This is a situation which is observed in GERD disease. Whatever the gastric acid secreted in stomach, that will come back into our esophagus. Next, coming on to 37th question. 37th question. Status OTA process is used for the extraction of. Okay, alkaloids, it is correct. Even for glycosides also, we'll be using this status OTA process. I don't want to explain the whole process of the status OTA process. Why? Because you're not writing any theory exam. You just remember status OTA process is used for the extraction of both alkaloids and as well as glycosides. And coming on to terpenoids. Terpenoids are extracted with the help of chloroform partitioning method. These are extracted with the help. Yes, glycosides kuda status OTA process tone extract chestam. Both alkaloids and glycosides are extracted with the help of status OTA process. Then C option, terpenoids are extracted with the help of chloroform partition method. You note this extraction process, you note in your notes. Terpenoids are extracted with the help of chloroform partition method. Then coming on to resins. Resins are extracted by taking 95% of alcohol, 90% of glacial acetic acid and 0.5% water. Mostly they'll ask you the names. What is the name of the extraction process for the particular drug? They'll ask you in this way. They won't ask you how much percent of alcohol is used, how much percent of acetic acid is used. They won't ask you. I'll repeat once again. 37th question. Status OTA process is used for the extraction of. It is used for the extraction of both alkaloids and glycosides. Even we can extract glycosides with the help of status OTA process. But third option is terpenoids. Terpenoids are extracted with the help of chloroform partition method. Terpenoids are extracted with the help of chloroform partition method. And resins are extracted by taking 95% of alcohol, 90% of glacial acetic acid and 0.5% water. Aruna, is this clear for you? 37th question. Answer ఏంటి అంటే both. మీకు kilo alkaloids అని ఇచ్చారు, but even glycosides are also extracted. Answer both A and B. Next, 38th question. Which of the following is not a risk factor of peptic ulcer? Not. ikkada not అని ఇచ్చారు. So regular exercise is not a risk factor of peptic ulcer. Next, coming on to 39th question. Which agency is responsible for regulating medical devices in India? CDSO. Then 40 question, it is very easy question. Full form of HEPA means high efficiency particulate air. Then 41st question. Which of the following is not a chemotherapeutic agent? Ee question chala important. I request all of you to take the notes. Coming on to 41st question. Cotrimoxazole. Cotrimoxazole is a chemotherapeutic agent. Carbamazepine is also a chemotherapeutic agent. But coming on to chlorpheniramine. Chlorpheniramine is not a chemotherapeutic agent. Chlorpheniramine is an antihistamine which blocks the action of histamine. Antihistaminic agent. Chlorpheniramine is an antihistamine. Then coming on to D, chloramphenicol, it is also a మైక్రోబియల్ ఏజెంట్. ఫస్ట్ ఆప్షన్ కార్ట్రిమాక్సిజోల్ నుండి చాలా క్వశ్చన్స్ వస్తాయి. 2 to 3 క్వశ్చన్స్ డైరెక్ట్ క్వశ్చన్స్ వస్తాయి. సో కమింగ్ ఆన్ టు కార్ట్రిమాక్సిజోల్, ఇట్ ఈస్ అ కాంబినేషన్ ఆఫ్ trimethoprim and sulfamethoxazole. You note this point. They'll ask you what is a combination of cotrimoxazole. It is a direct question. The combination of cotrimoxazole is trimethoprim and sulfamethoxazole. And the composition of this trimethoprim and sulfamethoxazole is 1:5. They'll ask you in this way also, what is the ratio of trimethoprim and sulfamethoxazole in cotrimoxazole. They'll ask you the ratio also. The ratio is 1:5. And the combination of cotrimoxazole is trimethoprim and sulfamethoxazole. Then next coming on to, it is a sulfonamide drug. Carbenzylin is it mainly blocks the cell wall synthesis. Chloramphenicol ante it mainly inhibits the protein synthesis by binding onto the 50S subunit of 70S ribosomes. It will bind to 50S subunit of 70S ribosomes and prevents the protein synthesis by blocking the activity of peptidyl transferase enzyme. Then next, coming on to 42nd question, which of the following is not a semi-solid dosage form? It is direct question. The answer is suspensions. Then 43rd question, which of the following is not a requirement for the labeling of medical devices? Option is, your answer is C. The label should not include the price of medical devices. A medical device paina manam price mention cheyalsina avasaram ledu. The next, coming on to 45th question, which particular technique will separate all other protein part from the immunoglobulin upon their purification from serum? What? 41 answer. 44th answer is 44th అసలు నేను ఇంకా రాలేదు. I mean 43rd only. 43rd, there is no need of mentioning the label paina price mention cheyalsina avasaram లేదు for a medical device. Coming on to 44th question, in State Pharmacy Council, all following are ex officio members. First, State Pharmacy Council lo ex officio members enta mandi untaru? You need to know this. Total you will be having 3 ex officio members, but manaki question em icharu, all are the ex officio members except one. Okkar ex officio member kaadu. Who is that? The person is President of India. Your answer is A. 44th answer is A. President of India is not a member of ex officio member. Then 45th question, which particular technique will separate all other proteins apart from the immunoglobulin upon their purification from serum? It is a direct question, all the above. Then next, 46, the points of interest for the development of successful capsule dosage form. It is also a direct question. Manaki physical chemical stability undali, filling composition, shell material. So all the above answer. Your answer is all the above. I don't want to stress this question. The next, 47th question, chickenpox is caused by varicella zoster. For communicable diseases, you refer my written notes. Then 48th question, seizures can be caused by. It is caused manaki brain injury అయినప్పుడు కొన్ని certain cases లో seizures అనేది cause అవుతుంది. Then when we are exposed to toxic substances, we can cause seizures. And malfunctioning of gene, this is also will cause the seizures. So your option is all the above. Then next, 49th question, which of the following is a function of gallbladder? Which of the following is a function of gallbladder? Ikkada sorry, we apologize you. ఈ క్వశ్చన్ ఆల్మోస్ట్ అన్ని ఈ 4 options are the function of gallbladder. It will store the bile, it will secrete the bile, it will absorb the water, it will absorb the nutrients, and it also absorbs the fats. ఇక్కడ నేను అపాలజైజ్ చేస్తున్నాను. కీలో వి గేవ్ యూ స్టోరేజ్ ఆఫ్ బైల్. It is a function of gallbladder. But either function, apart from this function, it also secretes the bile, it also absorbs the water, it also absorbs the nutrients and fat. Is this 49th question clear for you all? 49th question is clear for you all. Then coming on to 50 question, filariasis is caused by, it is mainly caused by Eucherasia bancrofti. It is a direct question. What are next 51 question? What are the uses of ondansetron? What are the uses of ondansetron? So ondansetron ante it ondansetron ante మన brain లో first రావాల్సింది it is a antiemetic. Antiemetic means it induces, it prevents vomiting. So chemotherapy or radiation therapy induced vomiting, it is correct. Post-operative induced vomiting, it is also correct. Drug and disease induced vomiting, it is also correct. So your answer is all the above. Apart from this function, it also, this ondansetron also have one function. You know that function, ondansetron prevents the vomiting after pregnancy. After pregnancy, some experiences vomiting. At that time, we can give ondansetron tablet. Then, in the pediatric dose calculation, the child in first 20 days of birth comes under which class? It is direct question, neonatal. Even 53 is also the direct question. Which of the following glucose transporters are important in fructose transport in the intestine? It is GLUT5. 54th question. Physical change may be almost visible. It is also the direct question. And 55th question. Which of the following is not a risk factor for developing a surgical infection? Surgical infection. It is also the direct question. The answer is obesity. The answer is obesity. Then 56th question. Coming on to 56th question. Which of the following statements are involved in manufacturing? Which of the following steps are involved in manufacturing of hard gelatin capsule? Almost these all steps are involved. So your answer is all the above. The steps involved in manufacturing hard gelatin capsule is dipping, spinning, trimming. Then 57th question, which among the following is a sterile preparation? I want to answer this. You can answer in the chat box. 57th answer is sterile. అనగానే మనకు రావాల్సింది ophthalmic preparations. Ophthalmic preparations. Then 58th question, what is a common over-the-counter medication used for constipation? We can use the common medication is laxatives. So, are you all there? I'm not getting any answers from your chat box. So, first option ante ibuprofen. Ibuprofen ante it mainly inhibits the COX-1 and COX-2 enzymes activity. Then acetaminophen. Acetaminophen, it mainly inhibits the prostaglandins in CNS. It mainly inhibits the prostaglandins in CNS. And this acetaminophen is a selective COX-2 inhibitor. It is a selective COX-2 inhibitor. Coming on to antacids, it mainly neutralizes the acid in our stomach. But how it in okay, manaku gurtuntundi antacid anangane neutralizes the acid in stomach. But how it neutralizes the acid in stomach means by inhibiting the pepsin. Pepsin inhibit chesi it will neutralize the acid in stomach. Then 59th question, it is a direct question. Kala Jadu or Kavach comes under the schedule J. That will comes under schedule J. 60 question, ophthalmic preparations are specialized dosage forms designed to be instilled in. మనం టాపికల్ గా యూజ్ చేస్తాము, ఇంట్రాక్యులర్ గా యూజ్ చేస్తాం, పెరియాక్యులర్ గా యూజ్ చేస్తాం. సో యువర్ ఆప్షన్ వుడ్ బి ఆల్ ద అబోవ్. 61 question, it is direct question. Sterilization ante killing or removal of all microorganisms. Next 62 question, Which law regulates the medical devices in India? It is direct question. Medical device rules in 2017. మనకి క్వశ్చన్ ఇలా ఇవ్వరు. క్వశ్చన్ ఏమి ఇస్తారంటే మెడికల్ డివైసెస్ రూల్స్ కరెక్ట్ ఇస్తారు, బట్ దెల్ చేంజ్ ద ఇయర్, దెల్ కన్ఫ్యూజ్ ద ఇయర్. సో యూ రిమెంబర్ ద ఇయర్ 2017. Then 63rd question, ophthalmic preparations designed to be administered inside, ikkada chudandi, inside the eye. Inside the eye means topical, means external. Intra means intraocular, means inside the eye. So your answer is B. 64th question, release of water soluble drugs can be retarded by presenting it as a dash suspension. It is a direct question, oil suspension. Then what is the mechanism of action of methotrexate? Methotrexate ante it inhibits the dihydrofolate reductase. But methotrexate drug class enti ante it is an anti-metabolite, it is an anti-cancer drug. Coming on to 66th question, in the preparation of cold creams, which type of base is used? It is a direct question. It is a very common question. You can expect this question. The answer is absorption bases. Next, 67th question. Coming on to 67th question. Which of the following test is commonly used to diagnose the peptic ulcer? మామూలుగా మనం యూజ్ చేసే టెస్ట్ ఏంటి? ఎండోస్కోపీ. It is also the direct question. Water soluble bases are also known as water soluble ante greasyless ointment bases. Greasy ante manaki it will float on the upper layer. So water soluble kaadu. Water soluble ante it should mix up with water. So water soluble bases are also known as greasyless ointment bases. So this greasyless ointment basis contains water soluble bases, but it does not contain fats and greasy substances. The example of water soluble base is emulsifying ointment. You note the example of water soluble base is emulsifying ointment. Next, which part of digestive system is most commonly affected by the peptic ulcers? Even this is also direct question. Peptic ulcer affect అయినప్పుడు mostly duodenum is affected. Then 70 question, capsules are manufactured by 70, that is gelatin. Capsules are manufactured by gelatin. Then 71 question, which of the following enzymes are not involved in galactase metabolism? Galactase metabolism మనకి ఇవ్వలేరు, బట్ మనకి ఎలిమినేషన్ ఆప్షన్ అనేది ఉంది. galactase కైనస్ అంటే galactase ఉంది కాబట్టి ఇట్ ఈస్ ఇన్వాల్వ్డ్ ఇన్ galactase metabolism. galactase 1 phosphorylate uridylase, it is also involved in galactase metabolism. మనకి ఎలిమినేషన్ ఆప్షన్ ఉంది కదా, glucokinase is the enzyme that is not involved in galactase metabolism. But I need the answer where this glucokinase plays an important role. మనం ఏ సైకిల్ లో glucokinase యూస్ చేస్తాం? I need this answer. Where this glucokinase enzyme is used, in which cycle you come across this glucokinase enzyme? Can anyone answer? Don't know? This glucokinase enzyme is used in glycolysis pathway. We had washed out this glycolysis pathway. To convert glucose to glucose 6-phosphate, we will be using what? Hexokinase or glucokinase enzyme? Then 72nd question, a suppository is generally intended for the use of all. We can use for rectum, vagina, urethra, all that. Your answer is all the above. Then 73rd question, if the drugs have maximum therapeutic value, which process is used for extraction? Even this is also the direct question. The answer is A, percolation. Then 74th question, the formulation used for the dental hygiene is known as. Dental hygiene అనగానే మనకు గుర్తుకు రావాల్సింది dentrifiers. Even it is the direct question. 75th question, General contraindication for the anti-cancer drug. These are all the contraindications of anti-cancer drug. Your answer is all the above. So 76th question, what are the risk factors of GERD? I don't want to explain about GERD. Why? Because I had already explained in one of the question. So I'll tell you the answer. The answer is all the above. GERD I had already explained in one of the previous question. So 77th question, the schedule in Drug and Cosmetic Act that deals with the requirement and guidelines of clinical trials. Clinical trials ante mana answer enti? Y. Schedule Y. Schedule Y is your answer. Then 78th question, what are some common causes of constipation? Common causes ante all the above. Constipation ante lack of fiber in the diet, lifestyle, certain medications. So your option is all the above. 79th question, ophthalmic preparations designed to be instilled onto external. I need the answer from you. External. The surface of the eye is also known as external ante topical preparation. The answer is A. You can chat in the chat box if you know the answer. Then 80 question, a condition where stomach contents flow back into esophagus, causing the troublesome symptoms and possible damage to the esophagus. దీనికి ఆన్సర్ అయితే నాకు కంపల్సరీ కావాలి. ఎవరైనా ఉన్నారా అసలు ఆన్లైన్ లో? The answer is, I need the answer. I won't tell you. I'll read you the question. A condition where stomach contents flow back into esophagus and causes troublesome symptoms and possible damage to esophagus. I need the answer. Stomach నుండి మనకి ఫుడ్ అనేది esophagus కి వెళ్తే that condition is known as GERD. So your answer is GERD. Then 81st question, which of the following is a silent feature of CGMP? It is also the direct question. The answer is validation of critical manufacturing processes. Then 82nd question, which of the following is not a unit of measurement of posology? It is direct question, kilogram. Then 83rd question, the stationary phase in TLC is, it is also direct question. The answer is silica gel. Antibiotics are used to treat the infections of. Why we'll be using the antibiotics? So we'll be using the antibiotics to treat the infection of bacteria. Then next, 85th question, simple staining uses dyes which are dash in nature for staining most of the bacteria. In order to stain most of the bacteria, we'll be using basic drugs. Basic nature ఉన్న డైస్ ని మాత్రమే మనం ఎక్కువ యూస్ చేస్తాం. యాసిడ్ నేచర్ ఉన్న డైస్ విల్ బి యూజింగ్ ఫర్ సమ్ ఎక్స్టెంట్ ఓన్లీ. We won't use the dyes which are in acidic nature mostly. Then 86th question, which of the following is prohibited to import? Prohibited to import ante we cannot import the misbranded drug. It is a direct question. 87, in the preparation of cold cream, which type of bases are used? In preparation of cold cream, we'll be using absorption bases. It is direct question. In preparation of cold cream, we'll be using the absorption basis. Then chemically, gelatin is it is a protein. Gelatin anedi protein. 89th question, absorption of drugs from gut does not occurs by. Drug absorption ante we can absorb the drugs in stomach with the help of simple diffusion, active transport, pinocytosis. But peristalsis anedi, it is not a type of drug absorption. Peristalsis ante it is a involuntary contraction or relaxation of muscles in our stomach. Involuntary contraction as well as relaxation of muscles in our stomach. So this is your answer. 90 to identify the emulsion type, which of the following tests are used? We'll use all the tests. It is a direct question. Then 91, incubation period of gonorrhea is 3 to 10 days. You can refer my notes. For communicable diseases, it is a direct question. 92nd question, which statement is true about synthetic drugs? True about synthetic drugs ante they can be patented. It is correct. Your answer is correct. But coming on to explanation part, B, they are difficult to synthesize. It is not much difficult to synthesize. Then C, they are usually more expensive to produce than natural substances. Okay, I accept they are expensive, but not much expensive. We are affordable. We are affordable. All the above is wrong. Your 92nd question is which statement is true about synthetic drugs? They can be patented. It is true. Then coming on to 93rd question, which type of medication is known to increase the risk of peptic ulcers? Risk of peptic ulcers can be increased with the help of corticosteroids. With the help of corticosteroids. Coming on to the explanatory part. Explanatory part ఏంటి అంటే corticosteroids examples ఏంటి? Corticosteroids అంటే methylprednisolone, hydrocortisone. These are the examples of corticosteroids. These corticosteroids will increase the risk of peptic ulcer. Along with these corticosteroids, some NSAIDs, ibuprofen, naproxen sodium, and serotonin reuptake inhibitors also increase the peptic ulcers. So along with corticosteroids, you know this, along with corticosteroids, NSAIDs, ibuprofen, naproxen sodium, and serotonin reuptake inhibitors also increase the peptic ulcers. Then coming on to 94th question, which of the following systems is used in Indian pharmacopoeia? It is direct question. We'll be using the metric system. Then coming on to 95th question, which of the following is not a function of large intestine? Not a function of large intestine ante the answer is secretion of digestive enzymes. Secretion of digestive enzymes. Digestive enzymes are secreted by pancreas as well as stomach. Large intestine digestive enzymes secrete cheyadu. So digestive enzymes are secreted by pancreas and stomach. Coming on to 96th question, the grade of very fine powder. The grade of very fine powder is 120. It is direct question. Then 97th question, what is meant by antibiotic resistance? It is also direct question. It means the bacteria have developed antibiotic resistance. Coming on to 98th question, Schedule X of Drug and Cosmetic Act comprises of. Then it is also the direct question. Your answer is narcotic drugs. This question wrong. This question is wrong. Schedule X is compressed by narcotic and psychotic drugs. You know this. Schedule X ante narcotic drugs, psychotropic drugs, Schedule X kindiki vastayi. The next 99th question, crystallization is an example of dash incompatibility. Crystallization is an example of delayed incompatibility. It is also direct question. 101 minim is equals to 0.06 ml. Coming on to 101 question, what is the net gain of ATP during the conversion of glucose to pyruvate? So coming on to 101 question, the question framing is little bit wrong, not totally wrong. It is little bit wrong. So coming on to the explanatory part, ikkada 2 ATP, your correct answer is 2 ATP, but 2 ATP are produced when the pyruvate is your when the lactate is your end product, 2 ATP is your correct answer. Lactate end product unte the energetics is 2 ATP. So lactate end product and it will take place in anaerobic condition. Then when the end product is pyruvate, it takes place in glycolysis, takes place in aerobic condition. So number of ATP produced are 8. So is the 101 question explanation is clear for you all? Someone chat in the chat box. Someone reply me in the chat box. Question framing, okay, 2 ATP it is correct, but question framing is little bit wrong. For that I had provided you the explanation. Then 102, which of the following statement is not true? Which of the following statement is not true? 1 second. One second, which of the following statement is not true ante? First, I'll explain you the options. Alpha receptors increase the atrial resistance, whereas beta receptors promote the smooth muscle contraction. First, alpha receptors function enti? It will constrict the muscles and it causes the vasoconstriction. Coming on to beta receptors ante, it will relax the muscles. So this option is correct. Alpha receptors ante, it will constrict the muscles, vasoconstriction causes. But coming on to beta receptors, it will relax the smooth muscles. This option is correct. Then next, coming on to B, the skin and splanchnic vessels have predominantly alpha receptors. These alpha receptors are present in skin. Skin ante epidermis, dermal papillaries, దాంట్లో ఉంటాయి. Then coming on to splanchnic vessels are present in stomach. ఈ ఆప్షన్ కూడా కరెక్ట్. Coming on to C, vessels and skeletal muscles may constrict or dilate depending on whether alpha 2 or beta 2 యాక్టివేషన్. ఆల్ఫా 2 యాక్టివేట్ అయితే మనకి ఎట్లాంటి ప్రాసెస్ కంటిన్యూ అవుతుంది, బీటా 2 యాక్టివేట్ అయితే ఎట్లాంటి ప్రాసెస్ కంటిన్యూ అవుతుంది అది చెప్తారు. ఇఫ్ బీటా 2 రిసెప్టర్స్ ఆర్ యాక్టివేటెడ్, skeletal muscles get contracted. If alpha receptors get activated, they'll get dilated. The next, coming on to fourth option ante skeletal muscle vessels have predominantly alpha receptors and constrict in presence of epinephrine and norepinephrine. This is wrong. These three options correct, but this last option is wrong. Skeletal muscle, they won't constrict, they'll dilate and they'll activate the alpha receptor activators. Is one or two question explanation is clear for you all? Me answer enti ante option D is your answer. Your question is not correct. Skeletal muscles, they will not constrict, they will dilate. Then coming on to 103 question, mannitol is used therapeutically as a. It is also the direct question, osmotic diuretic. I don't want to waste time in this. And what are the side effects of domperidone? Domperidone side effects ante all the above. Domperidone side effects are all the above. Coming on to the explanatory part, asal domperidone ante enti? What is the category of this domperidone? It is a dopamine 2 receptor antagonist. Antagonist ante it will block the activity. So domperidone is a dopamine 2 receptor antagonist. Its function is it opposes, it will block the inhibitory effect of dopamine. As a result, it stimulates the gastric muscle contraction. Domperidone ante it is a dopamine 2 receptor antagonist. Antagonist ante ee dopamine receptor activity, it will inhibit the activity of dopamine receptors and it will stimulate the gastric muscle contraction. Is 104 question explanation is clear for you all? Then next, 105 question, which of the following is a common method for the preventing of central line associated bloodstream infections? Central line associated bloodstream infections ante it is direct question. Use of sterile techniques during insertion and maintenance. The next, 106 question, increase of second messenger CAMP concentration leads to. Your answer is protein kinase activation and protein phosphorylation. I don't want to waste much time. It is direct question. Then 107 question, which of the following plasticizer is preferred in capsule manufacturing? It is also the direct question. Your answer is sorbitol. Then next, coming on to 108 question, ephedrine decreases the intracellular CAMP levels by acting on. It is B. It mainly acts on alpha 2 receptors. Coming on to explanatory part ante CAMP ante cyclic adenosine monophosphate. It is one of the common secondary messenger. The function of this camp is it regulates the activation of G protein coupled receptor. Kindly note these points. It mainly regulates the activation of G protein coupled receptors. So if the G protein coupled receptors are activated, at that time our biological activities, whatever the biological activities that are taking place in our body, that will get regulated. That will get regulated. Is 108 question explanation is clear for you all? Then next, coming on to 109 question, which of the following is a common site for the surgical site of infection? It is also the direct question, skin. It is also the direct question, skin. Then 110 question, a non-drug part added. You'll read the question carefully. Non-drug part added to the formulation to aid dilution, stability, maintenance, taste and masking. Preservative ante it is used to prevent the microbial growth. Active ingredient ante whatever the drug we are using. Binding agent is also the excipient of our drug, but they had given non-drug part. Non-drug part ante additive. Your answer is additive. Apart from the excipients, you will be adding some of the additives. Then 111 question, it is also the direct question. What is constipation? Constipation ante a condition where bowel movements are infrequent or difficult. The next, coming on to 112, which of the following is required? Which of the following is a requirement of CGMP for quality control? It is direct question. Your answer is adequate testing of finished product. The next, coming on to 113, which of the following is a common cause of ventilator associated pneumonia? Ventilator associated pneumonia. You need to know what is the meaning of ventilator associated pneumonia. Meeku ventilator associated pneumonia meaning teliste you can answer. Your answer is bacteria. Ventilator associated pneumonia means it is a kind of lung infection. It is a kind of lung infection developed in the person who is kept under ventilator. It is a kind of lung infection that is developed when the person is kept in ventilator. So you know this point. What is the bacteria? They'll ask you what is the name of bacteria of the ventilator associated pneumonia. The bacteria is gram-negative bacilli or Staphylococcus aureus. They'll ask you what is the name of bacteria. They won't ask you in this way direct question. You know this. Ventilator associated pneumonia is caused by gram-negative bacilli that or Staphylococcus aureus. Then is 113 question clear for you? They'll not ask you in this direct way. They'll ask you what is the name of bacteria that causes ventilator associated pneumonia. The bacteria name is gram-negative bacilli or Staphylococcus aureus. Then 114th question, suppositories can be prepared by. Suppose it is a direct question. The answer is compression molding. Coming on to 115th question, the disintegration time for sugar-coated tablets. It is also the direct question. The disintegration time is 60 minutes. The disintegration time is 60 minutes. Coming on to 116 question, which of the following disadvantages does not limit your benzodiazepine as an anti-anxiety agent? Even this is also the direct question. The answer is high risk of drug interactions based on the liver enzyme induction. Next, coming on to 117. 117 kuda direct question. The narcotic drugs and psychotropic substances are passed in the year. They are passed in the year 1985. They are passed in the year 1985. Coming on to 118. This 118 is also direct question. What are the following statements regarding the 1,2 dihydroxyvitamin D3? All the statements are correct. The answer is all the above. 119. Which of the following is not a local anesthetic? Not a local anesthetic. The answer is C. Eggonin. Coming on to the explanatory part. Eggonin, it is a CNS depressant and it is a opioid analgesic. It is not a local anesthetic. It is a CNS depressant and it is a opioid analgesic. Coming on to 120 question, it is direct question. How many types of incompatibilities are there? 3 types: physical, chemical and therapeutic. 121 question, what are the symptoms of food poisoning? All the above are correct. Nausea ఉంటుంది, vomiting ఉంటుంది, diarrhea ఉంటుంది. It is a key mistake. C is not the answer. Your answer is all the above. Then coming on to 121, 122 question, which of the following glycolytic enzyme which of the following glycolytic enzyme is inhibited by the accumulation of long chain fatty acid in the liver? It is also the direct question. The answer is glucokinase. The answer is glucokinase. Coming on to 123 question, the meaning of Latin Rx and take. It is direct question. 124, what is the potential side effect of overuse of laxatives? మనం laxatives ఎందుకు యూస్ చేస్తాము? In order to empty our bowels. Free movement of motion will be used. But if they are used in higher amount, will cause diarrhea. So next 125 question. 125 question. It is also direct question. Leprosy mainly affects the nerves and skin. You can refer my written notes of communicable diseases. Then 126th question. Which of the following is not a disorder of digestive system? It is also direct question. Anorexia, digestive system disorder. Nausea, it is digestive system disorder. Diarrhea is also digestive system disorder. But tachycardia, it is not digestive system disorder. It is CVS disorder, cardiovascular system disorder. Then coming on to 127 question. 127 question. 127 question ante BCG. BCG means antibodies obtained from TB potens. Then whooping cough. Whooping cough ante killed Bordetella pertussis. Salk vaccine, it is a freeze dried vaccine. And anti-serum for TB means it is live attenuated. That anti-serum is live attenuated. Then coming on to 128, which type of hepatitis is most commonly associated with jaundice? It is a direct question. It is hepatitis A. It is hepatitis A. Coming on to 129, vaginal suppositories are also called as direct question. That is pessaries. Even douches are also called as vaginal suppositories. Then, which of the following is a function of liver? Is a function of liver to filter the blood. The function of liver is it have to filter the blood. Coming on to 131, syrup IP contains how much percentage of water in water type of sugar? It contains 66.7%. Then 132 question, the source of codeine is opium. It is also direct question. Pharmacokinetics ante it mainly deals with ADME, absorption, distribution, metabolism and elimination. Pharmacokinetics ante what the body does to the drug. Then coming on to 134, which of the following statement is false? Which of the following statement is false? So C, option C is false. Clostridium tetani is a gram-positive bacteria. It is correct. Tuberculosis is a airborne disease. It is correct. But syphilis is not soil-borne disease. Syphilis is sexually transmitted disease. Malaria is a communicable disease. It is correct. Then coming on to 135, biologicals and biotechnological products are included in C and C1. It is direct question. 136, currently used alpha glucosidase inhibitors includes except all. Ante edi anni glucosidase inhibitors. One of the drug is not glucosidase. That is pioglitazone. Coming on to the explanatory part, pioglitazone, it is a oral anti-diabetic. It is a oral anti-diabetic and it comes under thiazolidine dione class. And alpha glucosidase inhibitors ante it mainly inhibits the absorption of carbohydrates from small intestine. The function of this alpha glucosidase inhibitors is it mainly inhibits the absorption of carbohydrates from small intestine. But coming on to pioglitazone, it is an oral anti-diabetic and it comes under the class thiazolidine dione class. Coming on to 137 question, epilepsy is most likely to begin in which age? Both A and B. Early childhood age and adolescence age. The next 138 question, what percentage of Earth's land is suitable for cropland and grazing? It is also the direct question, that is 3%. Coming on to 139, 139 is also direct question. You need to memorize the formulas of Young's, Dillings and everything. Your answer is Your answer is A. Dose of drug is equals to adult dose into age by age plus 12. You need to memorize the formulas. Then 140. Which of the following area has the lowest chance of producing biomedical waste? Agriculture, lands. It is also direct question. Dash compatibility may be corrected by changing the order of mixing. Tolerated. It is also the direct question. 141. Then coming on to 142. Pick the second messenger of G protein coupled receptor. Second messenger of G protein coupled receptor ante your answer is C, cyclic adenosine monophosphate. You fix in brain G protein coupled receptors ante cyclic adenosine monophosphate. Then 143, in the preparation of tablets, powdered medicaments are mixed by increasing the adhesiveness. Is it direct question? 144, which of the following is not used as a emulsifying agent? We can't use electrolytes as a emulsifying agent. Coming on to 145 question, which alkaloid was isolated from opium as a first crude drug? It is direct question, that is morphine. Forms. Even I have the tabular column about forms. I'll forward you that. Someone remember me personally. I'll share you vaccines, forms, and penalties. I'll share you my written notes. Then 146, the answer is A. Then 147, which of the following is not one of the three main parts of small intestine? Three main parts of small intestine. Cecum is not a main part of small intestine. Coming on to the explanatory part. One second. The main parts of intestine ante duodenum, jejunum, ileum, colon. But cecum ante enti? Cecum, it is a pouch. It is a pouch which connects both small intestine as well as large intestine. Cecum ante, it is a connection between large intestine and small intestine. It is not a main part of small intestine. 148, the family of Epicac is? It is direct question, Rubiaceae. 149, for extraction of thermolabile drugs, which extraction process should be used? Even this is also the direct question. We can use both percolation as well as maceration. Then 150 question kuda direct question. As per Drug and Cosmetic Act, Schedule N is related with list of minimum equipments for efficiency running of pharmacy. So paper explanation had been completed. If you are having any doubts అంటే అట్లా కాదు, ఏవైనా నేను రెక్టిఫై చేసుకునేది ఉంటే చెప్పండి. ఎనీ రెక్టిఫికేషన్స్ నీడెడ్ ఫ్రమ్ మై పార్ట్? నా నుండి ఏమైనా రెక్టిఫికేషన్స్ కావాలా మీకు? If you need any rectifications from me, you can chat in the chat box. If you are not having any rectifications, if you are okay with this, I'll continue in this way only. Medical devices question number చెప్తారా? Medical devices, it is to అంటే క్వశ్చన్ నెంబర్ చెప్పండి నాకు. సో మీరు క్వశ్చన్ నెంబర్ చెప్తే నాకు ఈజీ ఉంటుంది. Medical devices 2017 option. I don't know the question number, but medical devices 2017, it is a direct question. Need to see your chat. I want the question. At least you tell me the question number. 70. 70, it is capsules are manufactured by gelatin. 62. Which law regulates the medical devices in India? Medical devices rule. That is 2017. ఇది డైరెక్ట్ క్వశ్చన్ కదా. Medical devices are regulated by the Medical Devices Rules 2017. Okay, once I'll cross check about this medical devices. Even I got the, even when I'm preparing, even I got the thought. It is drug. It comes under Drug and Cosmetic Act. 39th. ఇది డైరెక్ట్ క్వశ్చన్ కదా. విచ్ ఏజెన్సీ ఇస్ రెస్పాన్సిబుల్ ఫర్ రెగ్యులేషన్ ఆఫ్ మెడికల్ డివైసెస్? దట్ ఈస్ సిడిఎస్ఓ. ఇది మెడికల్ డివైసెస్ రూల్ అండ్ డ్రగ్ అండ్ కాస్మెటిక్ యాక్ట్ కూడా రెగ్యులేట్ చేస్తుంది. బోత్ ఆప్షన్ ఏ అండ్ బి రెండు వస్తాయి. అంటే నేను మీకు ఒక క్లారిఫికేషన్ ఇస్తాను. ఎపికాక్ రూబియసే అంటే కీ మిస్టేక్స్ ఉన్నా కానీ వైల్ ఐఎమ్ డిస్కసింగ్ ద క్వశ్చన్ పేపర్ ఐ విల్ టెల్ యూ. ఓకే, ఐ విల్ రీడ్ ద క్వశ్చన్ 2 to 3 times. Epica belongs to Rubiaceae. You don't worry about key mistakes. While I'm explaining, I'll correct that key mistakes. ఎందుకంటే ఇప్పుడు మీరు ఎడ్మింగిల్లో ఆన్సర్ చేసేటప్పుడు కొంతమంది క్వశ్చన్స్ ఆర్డర్ చేంజ్ అవుతుంది, కొంతమందికి ఆప్షన్స్ కూడా చేంజ్ అవుతాయి. యూ డోంట్ వరీ అబౌట్ కీ మిస్టేక్స్. వైల్ ఐఎమ్ ఎక్స్ప్లెయినింగ్ ఐల్ గివ్ యూ విచ్ ఇస్ రైట్ ఆప్షన్, విచ్ ఇస్ రాంగ్ ఆప్షన్. అంటే మీరు ఆ ఎగ్జామ్స్ అటెంప్ట్ చేయండి. ఏమైనా కీ మిస్టేక్స్ ఉంటే నేను ఎక్స్ప్లెయిన్ చేసేటప్పుడు ఐ రెక్టిఫై దట్ మిస్టేక్స్. మీరు అటెంప్ట్ చేయండి. ఈచ్ అండ్ ఎవ్రీ క్వశ్చన్ కి నేను ఎక్స్ప్లెనేషన్ ఇస్తాను. ఈవెన్ నేను షార్ట్ కట్ లో ఒకటే చెప్తాను. ఈవెన్ మీరు ఇప్పటివరకు ప్రిపరేషన్ చేయకపోయినా ఈ 30 days నేను చెప్పే ఎక్స్ప్లెనేషన్ ప్రిపరేషన్ దట్ వుడ్ బి సఫిషియంట్ ఫర్ యువర్ డ్రగ్ ఇన్స్పెక్టర్ ఎగ్జామ్. You leave about your past, you attempt these 30 questions.